Hello everyone, Dr. Sunil Dhand. The three biggest financial settlements in US history by big pharmaceutical companies. Now it is very sad and also very disappointing that some of the biggest financial settlements in US history by all companies have come from big pharmaceutical companies. These are companies that are supposed to be in the arena of health and wellness. Really disappointing indeed. I wanted to share with you three of the biggest settlements. This information is from Wikipedia. It's also to be found on lots of other websites. It's all available online. So here we go then. At number one, we have GlaxoSmithKline in 2012. $3 billion settlement, $1 billion for criminal activity and $2 billion for civil violations. The violations were criminal activity, off-label promotion, failure to disclose safety data. The civil violations were paying kickbacks to physicians, making false and misleading statements concerning the safety of Avandia, that is a diabetes drug, reporting false best practices and underpaying rebates owed under the Medicaid drug rebate program. Which products were cited for violations? Avandia, the diabetes drug, Wellbutrin, that is a medication for depression, Paxil, that is also for depression, Advair for asthma, Lamictal, which is an anti-seizure medication, Zofran, an anti-nausea medication, Imitrex for migraines, Lotrinex, which is a medication for irritable bowel syndrome, Flovent, also for asthma, and Valtrex, which is an antiviral. And the laws violated were False Claims Act and FDCA. FDCA stands for Federal Food, Drug, and Cosmetic Act. So who do we have coming in at number two? Pfizer in 2009, $2.3 billion settlement for off-label promotion and kickbacks for the drugs Bextra, which is an anti-inflammatory, Geodon, which is an antipsychotic, Zyvox, an antibiotic, and Lyrica, a medication for nerve pain. And the laws violated were, again, False Claims Act and FDCA. And let's see who's at number three. Johnson & Johnson in 2013, $2.2 billion settlement for off-label promotion, kickbacks, and the drugs were Risperdal, which is an antipsychotic, Invega, which is also an antipsychotic, and Nesiritide, which is a medication for heart failure. And again, the False Claims Act and FDCA were violated. So the list goes on and on. Numerous companies, other names that you've heard of before, all cited for criminal and civil violations. It is staggering and extremely disappointing. Remember, these are companies that are supposed to be all about health and well-being. Keep in mind too the following points. Number one, all of these happened, these top three instances, in the last 10 to 15 years. We're not even talking about that long ago. And they are major household names. We've all heard of these companies. Secondly, the staggering dollar amounts that these companies paid in civil and criminal fines. Billions and billions of dollars. Think how much money they must have been making to even afford those types of fines. These numbers, these billions of dollar fines, are actually more than the entire GDP of many small countries across the world. Something to really reflect on there. And thirdly, keep in mind the nature of these violations, these criminal and civil violations. I've cited some reasons there, but you can even dig into the stories in more depth. What was going on and how these companies were basically breaking the law to sell their products and in the end got caught and faced these huge fines. Keep this other thought in mind as well. If any professional out there had this type of history, including physicians, they wouldn't be allowed to practice. So we have to watch these companies like hawks. That is the only way to ensure that things like this, which happened very recently, don't happen again. These are money-making companies. They are for-profit companies, and they must be watched. The public must hold them to account, and they must always be fully transparent. That is the only way to ensure that this doesn't keep happening again and again, because their track record, their history is absolutely horrible. And I'd like to remind you all one more time, these are supposed to be companies that are in the health and well-being arena. So let me know your thoughts down below. Dr. Sunil Dhand, thanks for listening. You can hit the subscribe button for more similar videos on my news channel. You can also follow me on my Real Medicine and Health Science channel. The link is down below. We will speak again very soon.